So in chapter 4, we are going to be looking at assessment and diagnosis issues. So I just want to clarify what assessment is. Assessment really is a term we use to describe the way we gather information. I mean, the goal of child psychology is to get as much information as we can about an individual child or a family. Ideally, when we assess anything, we want to get as much information as we can to understand what we're dealing with. So, to understand the importance of this, I want you to sort of think about the following situation. Okay, let's say a probation officer refers a 14-year-old named Brian for psychological assessment. Okay, the boy was caught shoplifting, stealing, and then fleeing from the police. So you're the psychologist now who interviews Brian and his mother, and the mother, claims that Brian's a quote good boy, who really has shown more problematic behaviors because his father was recently put in jail. So when you talk to Brian, Brian expresses remorse for his behaviors. He asks for a second chance. He says he's willing to turn over a new leaf, yada, yada, yada. So based on this interview data, you as a clinician might erroneously conclude that Brian's behavior is really just reflective of the fact that his dad got put in prison. But let's say you relied on different sources of information, different assessment methods. Your conclusion may have been different. Maybe if you had some informal data, for example, if you had gathered some information from his teachers, it might reveal that Brian actually has a history of aggression, callousness, and deceit. So the whole idea is that assessment should always come from as many sources, reliable sources, that we can get our hands on. And assessment is, there's many purposes for assessment. Number one is to screen children for behavior problems or for developmental delays. So a pediatrician might ask a psychologist to screen a child who's showing some language delays. Number two, we assess in order to sometimes reach diagnosis, and diagnosis is sometimes helpful in understanding what the child's going through. It also will give us some information on their potential for prognosis, and it will help a clinician make, an effective treatment plan. Number three, some assessments are conducted in order to identify and treat a specific behavior problem. So school psychologists might assess a student who is known as a bully, and the purpose is not to necessarily assign diagnosis, but to look at the causes of bullying and then plan some intervention around that. And then finally, assessment is sometimes conducted in order to monitor progress in treatment. So a doctor may prescribe Ritalin to a boy with ADHD and may use teacher ratings over 3 weeks to determine, is medication actually working here? Okay, so when we look at comprehensive assessment, it also requires that some consideration be given to the child's strengths and limitations in different areas, whether it be language, self-care, coping, etc.